Hello friends, we are the student of Ashok Ramani Institute of Pharmaceutical Sciences and Research Survey. We are discuss on topic of patient counseling presented by Mr. Avinash Shinde, Mr. Tejas Patil and Mr. Venkatesh Attigdad, guided by Mr. A.N. Degatar. Definition of patient counseling: a form of patient education where the majority of information is provided to the patient for the purpose of education. Goal of patient counseling: to achieve the best clinical outcome of treatment by covering as many patients as possible. B. Time for counseling: usually done at the end of a long course of treatment, right before discharge. Rotational: patient uses supervision after discharge, preventing replace or complication. Also possible at the beginning or in the middle of treatment, depending on patient requirement. First, beginning. After diagnosis, if patient requires more details than the treating physician's outline. Second, middle. To ascertain the patient's feelings about the disease, severity, comfort, and problem in medicine uses. See, need for counseling. Two-way exchange involves a two-way exchange of information which is better than written communication. Legal or moral obligation: pharmacists legally or morally have to give necessary drug information in language the patient understands. Information gathering: a good counselor can win patient confidence to discuss their medication habits or issue they would usually hide. Benefit: beneficial to both healthcare team and the patient. D. Privacy requirement: place must be free from noise, interruption, or any possible directions for effective counseling. Impact of privacy: help the patient understand the importance and gain cooperation, improves the image of pharmacist, encourage patient to speak more about their inner problem and feelings. Classification of patient counseling: first, direct counseling and distant counseling. Utility: useful patients who cannot visit hospitals and clinics. Example, outpatient with chronic illness. F. Suitable person to give counseling. Candidates: doctors, nurse, and pharmacists. Why pharmacists are more suitable? First, availability. Away from the emergency environment, mostly available at all times. Second, expertise. Experts in human relation and the knowledge about drugs and their side effects. Third, environment. Their environment is more conducive for counseling. G. Special cases requiring counseling. Patient subjected to long-term treatment. Example, epilepsy. Patient with diseases but without severe symptoms. Example, prophylactic cases. Pa- patient using drug with narrow therapeutic index. Example, warfarin. Patient with danger of abrupt stopping of treatment. Example, corticosteroid therapy. Patient with potential for non-compliance, abuse or misuse of drug. Example, tranquilizer. H. Preparation of counseling. Their general steps: first, gathering information. Collect patient data including hospital record, culture, health, illness, benefits, attitude and practices. Second, review discharge. Ensure clear medication list and follow-up plan is ready. Third, select aids. Have appropriate learning aids. In that example, graphics, models, devices, pamphlets, advertisal resources available. For plan content based on the type of patient, child, mentally, terminally, and their level of understanding. I. Scope of counseling. Content checklist. All patient adhered and outcome. Importance of adhering to instruction. Expected duration and benefits of treatment. Inpatient discharge. Home care storage condition. Refill information and what to do for missed dosage. Outpatient all details. How to open administered drug. Timing and amount of dose. Side effect, missed dosage and duration. Specific regimens. Complexity, detailing possible drug and drug food interaction, teaching technique of self monitoring, interactive clothes verification, encourage patient to speak their minds. Pharmacist asks question to estimate understanding. Dispensing check error detection, showing drug to patient for complicated regimens. Packaging helps detect dispensing or prescription error. J. Effect or uses of counseling. First, A. Direct benefits, patients and clinical. First, knowledge, improved knowledge of disease and its treatment among patient. Second, compliance, patient compliance is improved, leading to better outcome. Third, reductory, repetition of drug in use can be avoided. For diseases aggravation is reduced. 5. Cost, emergency visit to the hospital or hospitalization subsequent expenses are greatly reduced. B. System benefit, documentation, pharmacist contribution to disease documentation is increased. Role, counseling plays important role in disease management. In clinical, pharmacist should be appointed in all hospitals. K. Barriers or problems in patient counseling. First, hospital or environmental barriers. Hospital environment, general wards are crowded, lack privacy, and have noise, making open discussion difficult. Remedy, take the patient to separate counseling room or at least a common room. Second, personal barrier, inadequate time or training. Timing time, clinical pharmacists tend to cut short session due to the pressing in engagements. Training, junior less experienced pharmacist may be allowed the task, reflecting poorly on quality of counseling. Third, patient related barriers, language barrier, patient often only know their knowledge mother tongue. English technical terms render counseling useless. Requirement, counselor must be able to speak the language the patient understand. Educational level, poor education level can make reading or comprehending written instruction difficult. Disabilities of body, advanced age often means impaired eyesight and hearing. Solution, counsel the counsel with written materials or sign language, repeat instruction you until understood. Patient motivation, lack of motivation due to chronic illness, depression or terminal stage can negate counseling efforts. Thank you.